The Centers for Medicare and Medicaid Services visited Alaska this past summer and conducted a focused site visit. As a result of their findings, they submitted a preliminary report that we responded to by developing a corrective action plan. This CAP or CAP is quite detailed and continues to be worked on. It includes many elements designed to address health and safety, service planning, access to services, quality assurance, and so on. And once we have that completely submitted to CMS and approved, that is the document that we will be working off of. In developing that plan, we have made some significant changes to our system and will continue to do so over the next year and a half, including reevaluating how we complete and conduct assessments, streamlining assessment tools, not only in their length but also in how we apply them. We now have an electronic assessment tool. We've added additional staff. We have expanded the pool of assessors by changing some of the qualifications. We have developed new policies and procedures which help in communicating to staff and others what the process is, and that eliminates confusion. And we are working with providers, soliciting their input by conducting a number of provider forums across the state, and also receiving their ideas via email and phone call, and gathering that information so that we can put that into our corrective action plan moving forward. Some of those ideas might be reflected in changes in regulations, which we're looking at in the next year. The corrective action plan was due to CMS on September 3rd, and we met that deadline. And since that time, we've been meeting with them weekly in order to flesh out specifics and more details with respect to the different elements. Some of the successes that we've had in doing so is we have found significant efficiencies in some of our business processes, including implementing the electronic consumer assessment tool, which is the assessment we use for waivers. We have also expanded the pool of assessors by changing the minimum qualification requirements so that we now have professionals who are not nurses but otherwise professionals conducting personal care assistance assessments. We have also reassigned staff within SDS to augment and support the activities of the assessment unit as well as our quality assurance unit. There are very many people to thank for their contributions in meeting the October 15th deadline, but also the other deadlines that didn't get so much press previous to this, and also the deadlines that are looming on the horizon and those that we'll be meeting in the next year and a half. So I think I'd like to thank the Department of Health and Social Services, particularly Commissioner Hogan and Deputy Commissioner Heffley, for their support through this process. And also, and so importantly, I'd like to thank the members of the Senior and Disability Services team, the SDS employees, because each and every one of them gave a lot of their personal time and energy, also working extra hours into the evenings and on weekends to do their part in making sure that this happened. And it was very difficult, and it came at a cost sometimes to their health, and certainly at a cost to their personal lives. But they were willing and committed to make it happen, and I just want to thank those people in particular. As I mentioned, there's so many other people to thank to help us get this far along the path. I want to thank the providers, the service providers and care coordinators in the state for their patience and understanding, and their willingness to help us in any way that they could, and they did. And I want to thank the families who were very patient, and I want to thank the Alaskans who are needing our services and who are hopefully now getting those services for their participation and willingness to meet with senior and disability services staff at probably inconvenient times. I think it's important to remember that what we have done today is still very, very early in the process of making the changes that we want to make. And the benefits, the fruits of our labor, will really not be fully appreciated for some months down the road. And so that is the point in time that I'm looking forward to, is after we have finished the corrective action plan and we are actually enjoying the new systems that we're developing through the corrective action plan. And for me, I'm looking forward to that day, and we'll celebrate when people who need services can get those services inside of a week, and that the services that they receive will be what they want and what they need, and will be of a very high quality.